So coming to the another important assessment of the baby head circumference. So this is the very, very important after baby delivery. That means after the birth. So the doctors, they have to check the baby height and also weight and head circumference to know the baby normal, like a health status, health condition. Why? Some babies may chance to get the small head circumference, or maybe some may chance to get the like a large head circumference. So why we have to check the head circumference? So this head circumference is very, very important. So because of the baby having any abnormality in the head, or maybe is the brain abnormalities, or maybe any congenital abnormalities, we can identify checking the head circumference. Normally, if you see the head circumference at the birth time, so it should be the 35 centimeters at the birth time. So that is around the 13.5 inches. So normal this one is. And also it is going to be increase of 1 centimeters per month for the first year, and also 2 centimeters for the first 3 months. So first 3 months the baby head size is going to be is a 2 centimeters going to be increased every month. Then it's going to be slower in the remaining period. So this is going to be the most prominent at the occiput and also about the suborbital ridge. So supraorbital ridge. So this is the orbit. So above the orbit and also occiput. So here we have to take the measurements. So with the measurement tape. So the tape also should be fixed one. That means it should not be stretchable. So we can place the tape over the supraorbital ridge here. So then we have to take from the above the ears. So then bring it back to the occipital protuberance behind the head. This is the occipital protuberance. So we have to place it. And also next one is the position. Use a flexible and also non-stretchable tape. So it should not be stretchable. If it's stretchable, it won't give the proper readings. The position of the tape is just above the eyebrows and also above the ears, around the biggest part of the back of the head. That is nothing but is the occipital protuberance. And pull the tape and also strictly to the compress the hair. So tight it and also had a measure properly. So it should be 35 centimeters at the birth time. So it's going to be according to the baby growth, it may change the circumference size. So at the birth should be 35 centimeters. At the 6th month, so it should be 44 centimeters. And also at the age of 4 years, so the circumference may be more than the chest circumference. So head circumference is going to be increased. A total 4 inches increase takes place. So here, initially the 13.5, at the age of 1 year, it will be 17.5. So that is the normal head circumference. So after the 1 year, 1 inch increment occurs between the 1 to 2 years. So every year is going to increase in the 1 year. So after the 10 years is going to reach the 90% of the total growth complete, with the width of the head completed by the 3 years, while the length of the head completes by the 17-18 years. So it's going to be 10 years around the complete 95% is going to be developed. So after the 17-18s, complete ossification, the head growth is going to be complete. So that is the reason if you see the baby head and also the complete bone formation is not complete until the 18 years. So if you see at birth time, the baby, you may feel here in the center, you may feel some depression. So that means the bone is not completed. The frontal bones, temporal bones, the skull bones are not formed completely. So we can easily find at the birth time the space here in between the skull bones. This is a frontal bone and this is a temporal bone and occipital and also parietal bone. So all together, but in the center there is no like a joining. So we can easily palpate. But if the baby grows properly, so it may unite and also it give the full like a head circumference and also head like a growth. So we can easily identify why we have to check. Just now we discussed, so some congenital abnormalities we can found if anybody having abnormality of the skull. So if you see the baby age is the less than like a 4 months, but if you see the head size, head circumference size is very large. So this type of conditions, so it may be because of the congenital hydrocephalus. So congenital hydrocephalus means hydro means water, cephalus means brain. If any water accumulation inside the brain, so because of any abnormality in the ventricular system inside the brain, and also fluid filled cavities are there, so which are called as ventricles. So if any abnormality in these ventricles, so inside the water contents which is circulated in the brain and spinal cord, so the fluid is called as cerebrospinal fluid. So if any abnormality in the cerebrospinal fluid, so they may chance to get the hydrocephalus. So it may be is a congenital or maybe acquired also. After birth also, the baby may chance to get. So if we measure properly, so we can identify so what is the defect of this baby. So we have to measure properly. Other than these hydrocephalus conditions, some other developmental anomalies such as the macrocephaly and also microcephaly. So this one is going to be if some people, some babies may chance to get the big size head or small size head. And also, if you see here, this is the microcephaly. Microcephaly means micro means a small, cephaly means the brain. So the brain size and also skull size is going to be decreased. So here, if you check, normally supposed to be like the full head. If you see the normal one, the baby head growth is going to be like a concave shape here, but is going to be the height is decreased. So you can feel the forehead size is going to be decreased, and also height of the skull is going to be decreased. So this is the microcephaly. In case of severe microcephaly, the head size is going to be is a less, and also we can easily identify with the measurement of the skull like a circumference. So these are the very important during the diagnosis of the like a congenital anomalies and also the growth anomalies.